Welcome to Bold TV. My next guest is an innovator set to turn the insurance industry upside down with his disruptive plan to ensure healthy people are charged less for insurance. Welcome, Manjal.
Thank you, Maria. I appreciate you having me.
You're welcome. I love what you're doing because as somebody who's health conscious myself, I feel we shouldn't be penalized when we get insurance. First tell me, what inspired the idea for your company?
You know, I'm a serial entrepreneur, and the day after I sold my last company, I was running a 10K race, and in the middle of it, I ended up with chest pains and ended up in the ER. I was 37 at the time. My father had had his first heart attack in his mid-40s, so my genes weren't exactly stacked in my favor, but I ended up really changing my diet, exercising, losing 40 pounds, and just realized that there really is a path to wellness through lifestyle change and through diet and exercise.
So I've actually kind of been a health nerd my entire life, but I do see that some people have health scares that finally make them say, hey, wait a second, maybe this health stuff really works. So this prompted you to start the company or focus more on your own health?
Yeah, exactly. You know, I grew up eating Apple Jacks, Fruit Loops, cinnamon rolls.
I saw them, the Lucky Charms. We had Lucky Charms. I wasn't that healthy.
Yeah, I mean, you know, and there's days I still love
Oh, yeah.
I will say that, you know, in changing my health, I realized that, you know, you really can use lifestyle. And then we decided that, you know, could we use a kind of a positive metaphor? Could we really financially incent people to take better care of their health? And so that led us to start Health IQ. And the idea behind the company is really to save money on initially first life insurance. Later on, we'll do other insurances. Not necessarily for the healthy, actually, but for the health conscious. So we give discounts to the people who really take responsibility for their health. That could be the 40-year-old triathlete, or that could also be the well-managed diabetic who
Yes.
is being
I
charged
actually
greater.
do, not to interrupt, I actually do know someone that has diabetes but is otherwise healthy. It's not their fault that they got the diabetic
Yes.
gene. So I concur with
Yep.
that.
Absolutely. You know, my grandma recently passed away at age 95, and she had been diagnosed with diabetes at age 22 and never
Oh,
went beyond middle school, never got a full education, but she ate very carefully her entire life, did not end up needing insulin injections, did not end up having any other complications from diabetes until basically the last year of her life. And you look at somebody like that who's so disciplined and so careful about how they manage their health, and you say, you know, those folks should also save money. They may not get the same rate as somebody who doesn't have any disease at all, but they should get a much better rate than somebody who doesn't take care of their disease nearly as well.
I agree. So when someone goes to your website, healthiq.com, walk me through the steps. What do they see first? I know there's some sort of quiz involved.
Yeah, so you come in, you submit your information saying you're interested initially today in our life insurance. And then we basically qualify you one of two ways. We say, hey, will you take our Health IQ quiz to see if you can get the first level of discount? And that is 30 questions, actually, out of a set of 3,000 that we built. So there's 30 pulled at random, and these are questions that really assess your level of health literacy. And they're not self-assessment. So we don't say how many times a week do you drink and how many times a week do you exercise, where if you think about that, everybody, you know, tends to fib a little. Instead, we ask you things you would only know if you were doing. So if you say, hey, I tend to eat low carb, we're like, okay, which of these 4 tortillas at Chipotle tends to have the lowest carbs? And if you're really eating low carb, you tend to know which one to pick. And if you're not, you know, it's usually not something that you would know. Or if you do Bikram yoga, we say, are you supposed to drink water in the first 30 minutes?
Ah,
You know, and if you've never gone, you're thinking, oh, it's 110-degree yoga. Like, I'm
so
sure you're supposed to
you
drink water.
catch
But
the
if you've gone,
liars.
our idea is to test you. You know, the SAT
Yes.
doesn't say, hey, are you good at math? And if you say, yes, I'm good at math, it's like, okay, here's 800 points. It tests your skills, and we do a similar thing. We do it even with portion control. We say, you know, how many cups of rice is on this plate in this picture? And it's an important skill to know, because if you can do portion estimation, you can probably do portion control, and portion control is one of the keys to managing your weight. And so we test skills, and that's really what we do.
And there's an entertainment portion of it, a gamification part. Tell me about that.
Yeah, I mean, a lot of people enjoy, really sharing what they've learned and what they know, and kind of showing that they've really become health literate, in the same way people who have worked hard at something else really want to show that. So that's the first level of discount. There's a second discount if you'll actually give us data about your healthy health activities. We don't do this continuously. We just ask for it once, but there's different ways to qualify for that. You can run an 8-minute mile or 9-minute mile or 10-minute mile, depending upon your age. You can show that you walk a certain number of steps over the last few months. What we found is we don't need to keep checking, because really the people that have already done this tend to have done it for lifestyle changes, and those are things they're doing it for themselves, and they'll probably keep doing it. And as long as we're right on average, that's insurance. It's a game of averages.
That's wonderful. And what about focusing on prevention? Because I read an article about your company and about you that said that you really think the system is based on sick care, which I agree, and that it needs to focus more on prevention. How does this help with that?
Well, it's exactly right. Like, I think this country is having the wrong debate right now. The debate we're having is Medicare for all, or not Medicare for all, and private insurance, and that's a debate that maybe does need to happen on one level, but on a more basic level, we need to talk about prevention for all, and we need to talk about, really, there's 3 areas of prevention. One is health literacy, as we've talked about. With Health IQ, we not only test you once, but we give you a quiz every single day so that you can keep learning new things and testing yourself on new things. And we always give you the answer to the question, whether you got it right or wrong, so you can continue to learn. The other part is preventative testing. For every dollar we spend on prevention, we get $3.27 back. For every dollar we spend on lipid screenings, we get $9.64 back in terms of ROI. And so, we keep talking about wanting to improve really the healthcare costs in America, and wanting to give more access on the other side. But one of the keys to giving more access is going to be to bring the cost down. One of the keys to that's going to be prevention. Prevention is about literacy. It is about preventative testing. It's also about environmental. I think it's about 16% of all cancers, lung cancers, are actually due to radon in the home. And you can get a $12 radon test on Amazon and see if you have radon coming into your basement. And if you do, you can put a fan in your basement and fix it. And so there are some very simple, easy steps that just aren't being taken that could really save a lot of pain and suffering on the health side and a lot of cost to the system. And I truly believe that prevention for all is really the conversation that we should be having.
Yes, and I agree, and we're trying to do our part on Bold Health to raise awareness about issues and help people prevent illness before they get it, because like Manjal said, there are some simple things that everybody can do to maintain a healthy lifestyle and not get sick. Thank you so much for being with us. Where can people go to get more information?
You can go to healthiq.com, and also there on our blog we have some of our articles. And if you go to healthiq.com/quiz, you can take our Health IQ test, or download our app, Health IQ, and you can take a quiz a day, every single day, and just continue to improve your health literacy.
Thank you, Manjal. It was a pleasure having you here. Everyone, that is www.healthiq.com. Download the app, Health IQ. I think this is terrific, and you'll want to take that daily quiz. I can't wait to take it myself. Thank you. Welcome to Bold TV. My next guest is the founder and CEO of Oudair Health. He's created a tricorder style health assessment device called MouthLab. Welcome, Satya.
Thank you, Maria. Thanks for having me. I really appreciate the opportunity.
You're welcome. I was surprised to learn that in the United States, 50% of adults live with one chronic health condition. And things like obesity, diabetes, COPD, asthma. You were in a situation where you were a caregiver for your mom in India. Tell me about that and how that influenced you creating this tricorder.
Absolutely. I think the chronic condition is a major barrier. It's not something that is just happening in the US. I mean, if you look at it, it's a global problem. From my point of view, like I've had experience working in the healthcare setting. I spent a lot of time working at Hopkins trying to understand chronic conditions. But the challenge is from me when it comes to my mom, she has multiple chronic conditions, which was really challenging for me to manage at some point because like every single time when my mom gets hospitalized for a chronic condition, she asks me, could you do something to prevent me from going back to the hospital? The sad reality is I couldn't give her an answer. And that's where we really wanted to build a tool that can help communicate what's happening with their health.
And not only does the patient not want to go back to the hospital, but it's also an inconvenience for the caregiver as well. Your schedule, you have to drive them to the hospital, maybe take a day off of work. So it's very inconvenient to constantly have to go back to doctor appointments and hospital appointments as well.
No, absolutely. I think that's another reason. And also for providers who are taking care of patients in the hospital, they're finding it very difficult to send the patients back home because they don't think that they get the same kind of care that they get in a hospital at their home. And that's another reason why providers are also on board to help us with actually building a solution like what we built. Today, like we are doing studies at Johns Hopkins at the step down ward where the patients are really sick and but then they are to a certain extent can go home, but the providers don't feel comfortable doing it. So every patient who we are talking to today, they are super excited to use a device like what we have so that they can actually go home with the device. Providers are also much more comfortable giving such a device to patients because it is essentially monitoring every single thing that's happening with the patient at their home.
And the
So
patient doesn't have to be very tech savvy either. One of the things I
exactly.
like about it is the simplicity of it. Explain how you don't even need to have a computer. I mean, my parents are in their 80s now, and they don't use computers. Most of my aunts and uncles don't use computers. So this is simple. Explain to
Yeah.
me how, it's all in one place.
So as I mean, this is our device. It's a small handheld device. So basically, you hold the device and then put it in your mouth and then breathe through it normally for 30 seconds. At the end of 30 seconds, the data is actually sent to our secure HIPAA compliant cloud in real time. So using 4G or LTE-M, it's a proprietary LTE-M technology. So what that means is somebody like my mom who's not tech savvy, who's sick and who's old, and he's also challenging multiple drugs and treatments. For her, she doesn't even need to have a smartphone because the device itself is smart. It communicates via 4G. So, and also another cool thing about the device is it also has a speaker, so it can actually communicate whatever happening with her health with the speakers in there. So from her point of view, my mom does not even need to have a smart device if she has to use this device. But as a caregiver, I can download the app and I can actually get her information in real time because every day I'm getting multiple different notifications from all my social media and from my emails. One thing that would really make my day or like keep me happy is the fact that I'm getting one notification from our device saying like my mom is good. So
I
that's
love
how
that. I
seamless
love
it
that
is.
part of it. And so it's actually like a check engine light for
Yes,
humans. Uh,
that's true.
so now, would your mom see the information? Would the person using it see the information, or just the caregiver?
No, like my mom could see the information. The challenge is my mom still uses her flip phone, so that for her we can send a text message saying, okay, here's what is happening, and you're fine. Or if something is there, an emergency, or if not an emergency, at least something that is out of whack, then basically it sends a notification to me as well as to the doctors, so that for her there's a message that says, hey, we have sent information to Satya as well as your doctor X, so they will get back to you. right?
That's great.
That's one way. And also the speakers can also be a way to actually communicate what's happening with her health. And if she is okay to download an app, she can always download our app, which has all the information.
Now, I know people with chronic conditions are ideal candidates for this, but is this something that everybody should have for preventative
Yeah,
measures?
absolutely. So one thing that everybody looks at it is like, okay, hey, I'm healthy, I'm fine, and I don't need such a device. But I have like hundreds of stories. Like even recently, I heard one of my friend and her dad was actually hospitalized for a mild stroke. The challenge is like he was healthy, he was fine, and he was okay. But then the symptoms arise like few days before or even on the same day. Luckily, he was smart enough to go to the hospital to take care of himself. But then 9 out of 10 times people just ignore such episodes, such events that could actually lead to drastic events.
Yes.
So that's why what we really wanted is like have this device to be used by everybody. Hopefully, by in 10 years, we want every single individual in this world to be using this device because we just don't want to provide a solution that is just only for patients. Ideally, it's a great tool to start with patients, but it is great for like children's and quantified self people. A lot of athletes reach out to us to get a device like
Sure.
this, and we're also talking to NASA to see if we can actually send this device to space.
Wow. That would be terrific as well, a moonshot. Um, Let me ask you, does a person need a prescription from a physician to obtain it, and what does it cost?
So right now, what we really wanted to do is like we want to curate who gets this device and then who uses it and how well they use it. So we wanted to do it more like a prescription base. So you can get it as a prescription from your physician. You can go tell them, hey, I love or her, like I love this device and I want to have it, or the physician can do prescribe to the patients. But then ultimately, in a year from now, we wanted to actually also sell it to the consumers. Um, Right now, we are looking more like a SaaS model, like a per member or per patient per month, where we get the device technology and also get the services. It's more like an OnStar for health.
I love that. I do hope that we get to see this soon. Do you have any competitors in the space? And if so, what makes yours unique?
So basically, there's competitors when you say like there's a lot of point solutions that are there, like for example, blood pressure cuff, pulse ox, thermometers, and there are also companies that are actually providing all these different tools into one setting, and then they just bring it to your home and then put it into a closet where you expect them to use it every day, which is really complicated, confusing, and does not empower the user to actually use it. And there are other companies has like variables, like you have to connect and that measures three or four things. I don't see a direct competitor with what we are trying to achieve. But when you're looking at the real competitive value, is basically our device it actually goes in the mouth, right? It has access to breath and saliva, which in turn gives access to many biological indicators of health. So our future iterations will have like biochemical analysis that is done based on saliva and breath, so you can add like hundreds of sensors to there or like microchips there that can detect a lot of different conditions. So this is the first version, and we expect to have like another 20, 30 different versions of the device in the next few years.
And tell me again, and tell our viewers exactly what it measures, because it does a lot.
Yeah. So today it measures your temperature, blood pressure, ECG, oxygen saturation, pulse rate, breathing pattern, heart rate variability, and spirometric lung functions, which is basically your FEV1, FVC, FEV1 over FVC, and PEF. Or so basically, these are things that are already there, and then there are other things that we are currently working on, which will eventually be part of our device.
And maybe one day it can speak. Adar, what is my blood pressure?
Yeah, exactly.
Well, I think that's terrific. And where can people get more information about this?
Yeah, people can look at our website. We were before multi-sensor diagnostics. Now we actually rebrand to Aid Our Health, or Aiding Our Health. So you can find more information at www.aidar.com, AIDAR.com. You can also find more information on our Twitter at Mouth Lab. And you can also find me on LinkedIn and connect with me. My name is Sathya, Sathya, and Elumulai. Find me, connect with me. I would love to hear from everyone, because our goal is we got it this far. Like it's been almost 10 years work. My co-founder is a genius. He's a professor at Hopkins. So what we really want is like each and every one of you here who's listening to this to join us.
I think it's wonderful what you're doing. It will help millions of people get better care, and also what our last guest talked about, prevention. And like I said in the beginning of the interview, it not only helps the patient, but it helps the caregiver. And it really is 21st century medicine. And I'm so glad you're doing this, and wish you a tremendous amount of success with this. I think it's terrific. Thank you, Sathya.
Thank you so much again. Have a great one.
And everybody, that's AIDAR.com for more information, or you can connect with him on LinkedIn. Thanks so much for joining us. We'll see you next time. Welcome to Bold TV. Exciting topic today. My guest is a surgeon, scientist, aviator, and futurist. He's a pioneer in discovering placenta cells can be used to fight disease. The umbilical cord used to be thrown away at birth. Now, blood from it can be stored for the future health of your child, family members, or anyone else in need. Dr. Hariri is the world's leading expert on placenta stem cells and their therapeutic applications. He's here to explain. Welcome, Bob.
Thank you so much for having me.
It's such a pleasure to meet you. You're kind of a rock star in the medical industry.
I don't take that title lightly, but thank you very much.
You're welcome. I read a fascinating story about how you first made the discovery about placenta cells, and it has something to do with your daughter. Tell us about that.
At the time, I was a young surgeon at Cornell, and my wife was pregnant with our first child, and I was rushing down to the labor and delivery area where they were performing the ultrasounds so that I could see the first ultrasound of my developing child. Now, as a surgeon and somebody who really thought they knew everything, I took one look at that ultrasound, and it dawned on me that although she was a peanut-sized embryo at the time, the placenta had already developed into a large organ.
Sure.
And I was convinced that meant it was the rate limiter for the development of the embryo and the fetus, and why was that? And that got me thinking that maybe the placenta played a big role in the production of these remarkable stem cells.
Isn't that amazing? I've always said that genius is simple, people who simplify things. And other people complicate it. So then you saw something, and it's kind of, when you think about it, it feeds all the nutrients.
You know what? It's a life support system. The placenta actually has evolved to provide not only protection against the variation in the mother's health and physiology, but also to serve as kind of a supply depot. It literally is where stem cells propagate, differentiate, and traffic into the developing fetus. And that means that at the end of a full-term healthy pregnancy, that organ we throw away is just chock full of these remarkable cells.
And that's one of the things that makes it better than traditional stem cell therapies. Tell me more about the unique properties of placenta cells.
So, in the effort to turn living cells into medicines, the challenge is, can we find a source material that is reliable, scalable, has the appropriate economics to deliver into a healthcare system, right? Everybody knows that cellular medicine is here to stay. We're already using cells to treat cancer, inflammatory diseases, and so on. But the reality is that the placenta is unique because the cells in this organ are one size fits all. What I mean by that is that, in bone marrow transplantation, you've seen the call for find a match, right?
Yes,
you have
I've done
to match.
Stories about that. Very difficult.
Very difficult. You have to find a match between the donor and the recipient.
Right.
Uniquely, the placenta has evolved to be what's called nature's professional allograft. What that means is that any placental cell can be used in any recipient without the need to match. So that means that instead of having to find a needle in the haystack, one donor to fit a recipient, any placental cell can be administered to any recipient and it's accepted.
Wow.
So think about this. The mother contributes half of the DNA to the developing fetus, which means she's half a match to that fetus. Yet she carries it for 9 months and doesn't reject the fetus. Think about surrogate pregnancy. The mother's not even related, yet she carries that placenta and its fetus for 9 months, doesn't reject it, it doesn't reject her. That unique relationship is conserved in the cells.
That's incredible. So it's almost as if so many lives could have already been saved because we discarded this. Think about all the lives that could have been saved with it, right?
I mean, that's a very good point. I often struggle with the fact that for decades, this organ is thrown away as waste. In fact, hospitals pay to dispose of it when it harbors so much life-giving material.
And is there a special process that you use to manufacture it?
So we literally have been doing this for 2 decades. When I decided to leave my faculty job at Cornell, as a faculty neurosurgeon and go and start this company, my dream was that we were going to turn living cells into medicines, things that we could deploy just like pharmaceuticals. But I knew that in order to do that effectively in a meaningful way, I was going to have to turn this into a product, just like a drug, just like a pharmaceutical. The reality is that the cells from this placenta can do everything from control the immune system to stimulate repair and regeneration. So think about it. We undergo a process of renovation all throughout our lifetimes. That process is driven by stem cells, and the placenta is basically a gold mine of these cells that can be collected, they can be isolated, they can be expanded or grown into multiple numbers, and then they can be stored in what we call cryopreservation. We freeze them down at ultra low temperatures, and they have an infinite shelf life, virtually an infinite shelf life.
That's incredible. And do you have a special patent? Can anybody do what you're doing?
Well,
I'm just curious.
It is very highly proprietary. We've developed this technology over the last 20 years. We've invested hundreds of millions of dollars in doing this. It's not something for just anybody. But the expertise you need to do this is extremely specialized.
Are you able to scale your therapies?
That's a great question. The reality is that if we couldn't turn this into a broadly usable, economical, and scalable process, it would kind of go the way of organ transplantation. Science and technology we know works, but is only used in a fraction of the opportunities it could be used, right? That would be a tragedy.
Right.
The beauty of the placenta, if you think about it, right? The placenta is like nature's 3D printer that prints a human being. Right?
Yes.
So the way it does that is by dramatically expanding and increasing the number of cells from a single cell. Remember, the placenta is a product of, after conception, after fertilization, one cell becomes billions and hundreds of billions of cells that continually expand and differentiate. They turn into specialized cell types to make up brain tissue, bone tissue, skin, nerve, etc. The beauty of the placenta is that those cells are so young that they can be dramatically expanded into many, many, many doses. From one placenta, we can produce hundreds of thousands of doses. So that's really a remarkable degree of scalability, which we think will meet the needs of all the healthcare opportunities out there.
Right. And you hear that and you have to wonder, I think people out there might think, is that ethical? But there are no ethical issues with this. Explain that.
Well, if you think about it, the ethical debate around stem cells revolved around the time when we had to destroy an embryo in order to isolate the cells. And, for personal reasons and so on, I thought that was a major challenge to this field getting off the ground. The other place they were finding stem cells early on was in the byproducts of an abortion. And so, one could argue that if you have to put the burden the ethical burden on the source of the material, it's never going to get off the ground and become a useful medical tool. In complete contrast, we've never had an objection to using the postpartum placenta. In fact, the Vatican not only has recognized this technology as being completely within the accepted standards of the church, but in practice, in 20 years of doing this, we've never had an individual object to the use of the placenta. So not only does it meet the moral standards of the society, but it also, if you think about it, right, it is a pro-choice and a pro-life technology, right?
Right.
So this is something that the donor chooses to contribute to society.
Right.
And it is a byproduct of a very pro-life event. So we've never had a challenge where anybody said, you're violating our personal beliefs or religious beliefs.
Right.
And because we can use this material to produce product that can serve everyone,
Right.
no one is excluded.
I think knowing what we know now is actually a sin to be discarding it for so long.
I feel exactly the
Right?
same way.
Right.
It's a treasure trove of materials. And by the way, not just do we use the cells to treat patients, we also take the leftover materials, and we have products on the market today that are used to treat serious burns, wounds, reconstructive applications. And so this is a byproduct of the most bioconstructive event in our lifetime. Throwing it away is kind of a tragedy.
Right. I was talking to someone about the use of it for skin wounds, and they said it's absolutely something that could be applicable towards that as well.
Absolutely.
It's amazing how many lives, and even if it just saves one life, just think about that, how important, how vital that is. Because if it's you or your loved one, that one life is so vital. So it's an incredible thing.
I agree with you.
You also leverage the power of partnerships. Talk about that.
You know, I've always been a relatively inclusive person, and I think that a challenge like turning living cells into medicines is such a tremendous technical and intellectual effort. If we want to get to the finish line faster, we need to engage and enlist the help of all of the experts out there. So we are always a very, very open collaborator with other corporate partners, academic partners, clinical partners, and my belief is that when successful, this is not only going to transform healthcare and transform our industry, but it also is a very, very meaningful place for investments. And so people who want to invest in breakthrough technologies find this a very attractive place to park their money.
And if anybody needs an integrative approach, it's medicine, because there's people doing things that could help each other and they're not talking to each other. So I absolutely agree that a collaborative approach in terms of what are you investing in and are all the partnerships is the whole circle together. So that's a wonderful approach to it. And now you're also a jet, an aviator, as if being a surgeon isn't enough, or a scientist. You're also, and I've heard you make analogies that to the human body from your flying experience. Tell us that. I always love that story.
I've been flying longer than I've done anything else in my life, and I'm very fortunate that I continue to be really active flying today. I probably fly more than most United pilots, but
Wow.
But the reality is, aviation is an industry that has become remarkably safe. The entire reputation of aviation is its remarkable safety track record. You know why that is? It's because the industry recognized that any failure, if you did a root cause analysis, you could identify what the mission critical event was that led to the failure, that led to a catastrophic event.
Right.
So in airplanes, we do things like highly preventative maintenance. Airplanes are inspected and parts are replaced on a calendar schedule and on a use schedule. If we applied that same approach to healthcare, we would be proactive, not reactive. Medicine today is a reactive specialty.
Right. You want to catch people at the yellow warning light.
That's right. I don't see a patient till something's gone wrong. If I saw them before it went wrong, it's easier to treat and the outcomes are much better. Now, in the airplane, what we have is we have two big buttons on the glare shield. We have the master caution and the master warning. One flashes yellow, one flashes red. The master caution basically means that the system interrogates to find if there's an impending problem.
Okay.
And if there's an impending problem, you can pull out your checklist and you could take steps to intervene before it becomes an irreversible problem.
Right.
Why not do that in healthcare?
Absolutely.
Okay? Why not, when a patient comes in, identify the master caution and intervene in a proactive way so that you never have to take them to the operating room under emergency conditions?
Exactly. Smart analogy. And what about, I think our audience really wants to know about the rejuvenation effects, because I've heard Peter Diamandis has said that 100 will be the next 60.
That's right. That's right.
Using placenta cells.
So
How do you see, tell me about that.
So, look, considering how much gray I have in my beard, this is as relevant to me as anything else. The reality is that years ago, I wasn't the first to recognize that there was a connection between the number of stem cells in your body and your ability to repair and renovate yourself in response to injury or disease. It turns out that there's a direct correlation between the number of healthy stem cells in your body and your age. So, if you think about it, we're constantly going through this process of renewal. If it's driven by your regenerative engine, which is fueled by your stem cells, and your stem cells decline in number and quality with age, isn't the logical thing to just replace those stem cells? So think about this. We have the ability to collect stem cells at birth and store them away for
Replace or repair.
That's right.
Right.
So we can store those cells away,
Right.
and you can get those cells back as you age. That's a way of replenishing this regenerative engine, and we believe it's a way of restoring your healthy form. And by the way, in the laboratory, in research animals, by giving back stem cells as these animals age, they live longer, dramatically longer. So I think that the future of longevity is going to be applying cellular therapies to what I call recharge your regenerative engine and allow you to maintain a youthful form as you age.
And living healthier, because I always say people that don't feel well don't want to live longer.
Absolutely.
So longevity has to be tied to feeling better as well. So this is something that makes you feel better, right? Or is it just look better? Feel.
The three pillars of healthy aging, three pillars.
Right.
High performance, maintaining high performance mobility, maintaining high performance cognition, your brain's got to work, and believe it or not, youthful aesthetics, maintaining youthful aesthetics actually creates meaningful lifespan. And so for me, when I look at the opportunity for us to impact health and longevity in the population over retirement age, this may be the simplest tool we have. There is a fundamental safety to the application of these cells based upon their history in the clinic up till now. And if you consider that what breaks down in us as we age, our vascular system breaks down, right? That includes the heart. Our endocrine system breaks down, and our brain breaks down. If you can do something to slow or arrest that breakdown, and cellular therapy might be the answer, you could restore tremendous quality to life as well as expand lifespan.
And what do you see it as a pill form or an
No,
injection?
just an injection.
An injection that people would take daily?
So
I'm always fascinated in what the future, and I don't believe that it's science fiction. It is actually fact. I was talking about how I covered this 21 years ago, and back then it was seen as something for the future. The future is now.
I agree with you.
Right?
And the truth of the matter is, what I envision, and this is my
Your dream. What's your? Yeah, I wanted to ask you
glimpse
that.
into the future. My glimpse into the future is that we will restore this regenerative power in people by something as simple as an annual infusion of stem cells that is a doctor's office visit or a clinic visit. And by delivering these into your intravenous blood flow, they circulate and distribute throughout your body and they have generalized effects. We know that intravenous infusion of these cells is very well tolerated and very, very safe. And in low doses, it's very innocuous. And the truth is that what you're doing is you're restoring and replacing a system that just degrades over time.
I actually think it makes sense. I really do. It makes sense because most of the best ideas come out of nature and out of our own body's ability to heal itself. So I think that it's genius, and I would love to keep an eye on you and your work and have us follow you and have you back sometime.
It would be a privilege to talk to you.
Is there anything else that you want to add?
No, I think, what I love about your show is that you're creating a foundation for people to become more inquisitive. So I hope that your audience takes an opportunity to use this as a stepping stone to learn more.
Thank you. Thank you very much.
Thank
it was
you.
a pleasure having you here.
My pleasure.
And where can people get more information about you or your company?
Our website is www.cellularity.com. That's cellularity with one L.
Okay.
CELULARITY.com.
Okay.
And the entire organization is on LinkedIn and other social media.
Great. Perfect. Thank you. I learned a lot today, and it's actually fascinating material. Thank you.
Thank you so much.
You're welcome. And thank you for joining us. These are exciting times. Thank you so much for being with us. And as you could see, Dr. Harari exemplifies being bold. We might have to change the name of the show to be The Bold and the Brilliant. Thank you, and join us next time. 747, I know, does not stand for a Boeing jet. How did you come up with the name for the company?
Yeah, 747 in all terms of the word, or how we use it, is kind of a symbol for something magical that occurs in the evening. So,
what is that?
So we've been in the habit of, for the last 3.5 years, producing dinner parties all over the world. And every dinner is the exact same. 6:30 p.m. cocktails begin, 8 p.m. dinner is served, but at 7:47 p.m. we delegate 11 specific tasks, empowering the attendees to work together to create the meal. So that time of the evening stands for a moment of connection, where people are so digital and disconnected and running too fast and always have things on their mind. When you can actually give someone a delegated task around the dinner table at 7:47 p.m., you help them take a pause in life, and that opens up the opportunity for connection.
I love that. It's very ritualistic.
Yes.
I'm a Virgo, so I know all about rituals.
Perfect. I'm a Virgo as well, August 31st.
Oh, I see. I did not know that about you.
How perfect is that?
Yes. Oh, love it. Virgos are very detail-oriented.
Okay.
So that explains a lot. I thought we only had the fanny pack in common. I love the fanny pack, but now it's a big trend, of course.
I know.
Right?
We got lucky and hopped on the bandwagon before it got popular, and now the world's catching up.
Well, tell me about, how is pasta sauce involved? Because we're also both Italian.
Yes.
And you started connecting people worldwide through your love of pasta sauce. So tell me about that.
Well, so funny thing, I actually brought you a jar of pasta sauce
I love
tonight.
it. I love it. 747. This is fantastic. Thank you.
Of course. So in July of 2015, we had just come back from Italy after producing a Broadway play over there. And when we got back to New York City, essentially realized we felt 4 things: lonely, unfulfilled, disconnected, insecure. Started fiddling with food in our kitchen and accidentally created a pasta sauce recipe, and figured we should probably feed it to people to see if it's even good or not, and started hosting dinners. And so that pasta sauce recipe, where the original dinner was 6:30 p.m. and the 7:47, all that came out of that original dinner. But we've done hundreds of dinners ever since. We've used that simple pasta sauce recipe to spark over 350,000 relationships around the dinner table, and decided to devote the rest of our life to it.
How are they invited? How do people get invited to these dinner parties?
So originally, when we were just doing dinners inside our home for that first year, the rule was the first time you come alone. The second time you come, you bring a friend. And then after that, you're eligible to nominate someone.
And it kept growing from
And it kept growing.
Wow.
And hundreds of thousands of relationships later, now it's a fully corporate model where we sell essentially our experience creation services to companies to help them build better relationships for their businesses,
That's
their clients, their
actually
partners.
a fantastic idea, because I was just speaking to a professor, Kevin, I want to say.
Okay.
And he did a study about how eating together creates bonds in
Yeah.
organizations and creates superior results. People are more productive, they're more cooperative, they're nicer. That when people work together, they may not even speak to each other on a regular business day.
Yeah.
Except when they're in the cafeteria. Food unites people. Food, cooking.
Oh, I
There
love
was
that.
a firefighter study.
Yeah, so-
was it it's the Cornell professor.
Yeah.
And when I talked to him yesterday, he said, I just looked at the link for Chris Schembra. What a guy. And he's going to contact you because he just thought, well, you're working.
The professor
Yes.
from the study.
Yes. the
Okay,
firefighter study.
so for those of you who are watching, in 2015, this professor at Cornell University did a
Yes.
study that proved that firefighters who eat spaghetti in the firehouse together are better perform at their job, save more lives.
Right.
That's pretty cool.
That's amazing.
And so we said, if we're going to devote the rest of our lives to hosting dinner parties, might as well keep it as pasta sauce.
Right. And I grew up in a very close-knit Italian neighborhood. I am still friends with my entire street, all the kids on the street. And every, when we were playing outside, someone's mother would be in the window yelling for us to come.
Dinner time.
Dinner time.
Yeah.
And they actually made that commercial out of it. It's Prince Spaghetti Time, remember? I don't know if you remember that commercial.
Oh,
with
yeah, that was a long,
Anthony,
yeah.
Prince Spaghetti Time.
Oh, yeah.
But I wonder if all of the cooking and the eating, because we do have a bond.
Yeah, I
You know,
mean,
there is a bond, and also the professor that did the study on firefighters found that even families that eat together have a better bond.
yeah, I mean, if you look at kind of the way we are as a society, 51% of the American workforce reports being lonely on a consistent basis. It's a huge problem. The Surgeon General of the United States equivocates that to the reduction of lifespan of smoking 15 cigarettes per day.
Wow.
7 years off your life.
Wow.
And if you can just share a meal with someone, if you can just volunteer with someone, if you can just spend quality time over shared passions or shared activities, you decrease that number just that much.
Right.
And the funny thing is, the origination of companies to begin with was over food. Do you know what the Latin origination of the word company is? Companis. If you break that word up, com means together, panis means bread. So we were always meant
Yes.
as companies to break bread together, and we somehow got away from that. We spend too much time worried about how we're going to get that deal over email, how we're going to get that deal via Slack, how we're going to talk to our
Right.
team via Zoom.
Right.
If you can just remove those digital barriers and share a meal together, you're infinitely more amounts productive.
And now, as the chief question officer, you also ask a question that other people normally don't ask. When there's a gathering of people together, people ask, what do you do?
Oh, yeah.
You don't
That dreaded
ask
question.
The dreaded question. My dad hates that question too. It's the what do you do? It's superficial. And
Yeah.
You ask a question that goes far deeper than that. It's the magical question. What is it?
Yeah, so 3.5 years ago when we first invented the pasta sauce recipe, we accidentally invented this question. If you could give credit or thanks to one person in your life that you don't give enough credit or thanks to, who would that be? And after asking that question to tens of thousands of people in the last 3.5 years, we realized it was unique because it wasn't asking people, what's your biggest fear? What's your biggest failure? What are you most vulnerable about? That catches people off guard. It gives people the platform to share a story. And Steve Jobs always said, you can't connect the dots looking forward. You can only connect the dots looking backwards. So us, in daily life, we're so far focused on the future. The future is filled with doubt and insecurity and loneliness. Why don't you take a pause and give people a platform to reflect on where they came from and who helped them get there? You'll learn more about the values that those people stand for by listening to those stories. So much more.
I love that. And people get really vulnerable
Yeah.
at these dinner parties, don't they?
Yeah. At the average 18-person dinner, if less than 6 people cry, we consider it a failed night. The average is 10.
Wow.
So by the time we've prepared the meal together, sat down for dinner together, and then asked this question for people to go around the table talking about it, they're super comfortable and they really open up. It's a pretty cool thing to see.
And there's also a vulnerability that comes with people talking about their own failures, that if you read a lot of autobiographies of a lot of successful people, you realize it wasn't a straight line. Success is more like this. And if you talk about your fears and your failures, you can connect with someone a lot more than putting on a
facade, like
Yes.
an Instagram filter.
Yeah,
I
talk about that, because I think that's important about how people genuinely connect in a world that seemingly is supposed to be connected, but paradoxically is doing the opposite, making people lonely.
Yeah, I mean, Kurt Vonnegut, one of the great writers
love
of the
him.
60s and 70s, found that there were essentially a few different emotional arcs in narrative storytelling that a hero or protagonist can go through. And one of those 6 that he found was that if you knock down the hero in the beginning, if you knock down the protagonist and make him vulnerable in the beginning, then you can build him up as the hero towards the end, and the audience will fall in love with him. Think Superman.
Interesting.
First thing we know about Superman, he's got an Achilles heel. He's got a vulnerability. He's an orphan.
You're right.
Right?
Yes.
And then you build him up.
Yes.
And so it's through that hardship and that hard work that people can connect.
Yes.
When you put on the filter, or you're riding high and achieving great things, and you try to connect with people through success, it's not real.
Right.
And it's driven by ego. And it's driven by who's better. But when you connect in the troughs, in the down moments, the moments of vulnerability, that's strength and that's connection. Because when you can talk about, if we ask this question about gratitude, for instance, we've surveyed 1,500 people in the last 4 months about this question alone. 25.68% of people have given voice to their mother. If you have a room full of 18 people,
have given thanks to their mom,
given
gratitude,
credit and thanks.
as someone that they don't thank enough.
Exactly.
Oh, wow.
And so if you empower people to talk about their mothers in a room full of 18 people, that's connection. Because we all have a story about our mother, whether it's positive or whether it's negative. I mean, just this week we had a respondent to our survey write in giving credit and thanks to her mother. Her mother gave her up for adoption at the age of 8. Her and her 2 younger siblings. The mother took them off the streets at the age of 14, readopted them, only to then kick them back out onto the streets. So
Why?
here she is, now as a single mother, giving credit and thanks to her mother because now that mother's finally become a good grandmother. Shitty mother for so many years,
Okay.
but how history has come around.
Full
And
circle.
how the tides have come full circle. And now she's a great grandmother. And so what was a moment of pain for her entire life, this mother who abandoned her, is now the greatest sense of joy and helps her become a better mother herself. So these amazing stories that we hear. People overcoming fear.
And more importantly, you're connecting people in real life. Because who you mentioned, Von Gutt, also said that he learned in his study that the number 1 killer wasn't cardiovascular disease, it was loneliness.
Yeah.
The disease of loneliness that comes from being disconnected in real life from
Yeah.
people. So you're connecting them on a deeper level, and that makes people healthier and organizations healthier.
Yeah, our core hypothesis at our company right now is that using this question, giving gratitude to others, is the key to fulfillment. Giving gratitude to others leads to empathy. Giving gratitude to others helps you become less lonely. And giving gratitude to others ultimately leads to business results.
And how do you define empathy?
Empathy, I won't define, but a great man named Roman Krznaric, the founder of the School of Life, the author of a book called Empathy, Why It Matters and How to Get It, defines empathy as the art of imaginatively stepping into the shoes of another person, understanding their feelings and perspectives, and using that knowledge to guide your action. Right? So
I like that
in
yeah.
order to get empathy, You have to take action to develop it. The act of giving gratitude to others from your past is that action that develops that empathy. You learn about those around you when you ask them. And ultimately, that leads to business results.
I agree. I absolutely agree. And on whatever position you're in, if you're doing sales, if you're a producer, if you're you need to step into your customers' shoes and know what they're thinking and feeling.
I like that.
I just recently saw an interview with the Home Depot CEO, and when he first started out, he said, if someone didn't buy something in my store, I would run after them and ask them, excuse me, but why didn't you buy in my store? And he said, and they would say, you didn't have this item.
Yeah.
And he said, I'll get it for you.
Interesting.
Because he never wanted someone to leave his store feeling unsatisfied. And that was empathy, I think, develops the greatest leaders of all time.
Yeah, I mean, literally 91% of CEOs believe financial performance is directly linked to empathy. Right? Empathy is a subset of emotional intelligence.
Yes.
Emotional intelligence is the hot topic these days. Well, people with high emotional intelligence earn $29,000 more per year on average than people with low emotional intelligence.
Interesting. They should.
Right? 80%,
they should get a lot more.
Right? And so with empathy being a subset of that, it's directly linked to business performance. When you ask this question about gratitude, which is guaranteed to produce emotional responses, when you bring emotion into a B2B sale, Google, in their promotion to emotion study, found that bringing emotion into a B2B transaction, the customer is 5 times more likely to consider purchasing, 12 times more likely to purchase, and 30 times more likely to pay a premium. So you talk about a professional services firm like a doctor, a lawyer, a real estate broker or something. You want people to pay top notch for your service. Bringing emotion into that is the key.
And just to be clear, we're not talking about fake emotion. We're talking about genuine connecting with someone.
Yeah, if you ask this question about gratitude to anybody in your life, that's what we challenge you to do, is take this question and go ask it in a safe space to one other person, 18 other person, 5,000 other people, and you will see true, genuine emotion that creates long-lasting family-style relationships. And this question and the safe space that has been created around our dinner tables have led to tens of millions in net new revenue for our clients. The proof is in the pudding. And it's an honor to be a part of.
How do companies get in touch with your company to partner with them in order to create more empathic leaders and even learn something themselves?
Yeah, I mean...
How do they get a hold of you?
Yeah, companies can just reach out, info@747club.org.
Okay, info@747
club.org, and one of the team will reach out and we'll have a conversation, and similar to the Home Depot guy, we'll listen to your needs and we'll put your needs on the shelf.
And you might get to taste some pasta sauce.
Heck yeah.
Is this at every dinner?
The pasta sauce is at every dinner. It's also for sale. We're selling, the pasta sauce.
Oh, I love that. Where can you get the pasta sauce?
Just email in. And
Chris at 747.
Do probably info@747club.org.
Info@747club.org, and you can get some homemade pasta sauce. I'm so happy you brought one.
I'm so
I was
excited
actually going to ask you, so I'm so glad. You're so thoughtful. I'm so grateful.
Yeah.
And thanks for being a guest. Is there anything else you want to add?
No, this has been great. You're such an amazing interviewer.
Yes. Let's give a shout out to your dad.
Oh my gosh.
Phil
Shembra. Thank you for everything.
Phil does a lot of real estate in Hilton Head, South Carolina. If you're ever looking for a home there, Phil Shembra is your man.
Heck yeah.
And again, thank you. And we'll have you on again sometime to catch up and see what you're up to, because I know you do a lot of production and film. We didn't get to talk about that.
No,
but you can come back another time, because
pasta sauce. We've got a book coming out. Can't talk about it right now, but it'll be done in the next half year. So
awesome sauce.
Have to come back soon.
Awesome.
Thanks for having me.
Awesome. All right, Chris, thank you. Welcome to Bold TV. My topic today is empathy and the art of human connection. My guest is Chris Schembra. He is the chief question asker of 747. Now, I know 747 doesn't stand for a Boeing jet. How did you come up with the name for your company?
Yeah, thanks for having me, Maria. I'm so excited to talk about the topic of empathy. 747 is a time of night in which magic occurs. So what you're actually holding, which was my gift to you for this episode.
Yes, I'm so grateful. Thank you.
This is our pasta sauce, the 747 pasta sauce, a tool for connection. So where 747 comes from is actually this pasta sauce.
How so?
So in July of 2015, we had just come back to New York City from Italy after producing a Broadway play over there. And when we got back to New York City, we essentially realized we felt four things: lonely, unfulfilled, disconnected, and insecure. A lot like the rest of kind of the American workforce. And in that dark moment of disconnection, we accidentally invented a pasta sauce recipe and figured we should probably feed it to people to see if it's even good or not. So every week, we'd invite 16 strangers into our home and feed them our pasta sauce.
Wow.
6:30 p.m. cocktails began, 8 p.m. dinner is served, but at 7:47 p.m., we delegate 11 specific tasks, empowering the attendees to work together to create the meal. So that moment of 7:47 became a thing of magic, that when you could take these busy, super stressed out people and bring them into a comforting 18-person dining experience, and you gave them stuff to do together, it removed the stress, it removed the barriers for connection, and you could have a really good dining experience. So that's where 747 comes from.
I love it. And Kurt Vonnegut wrote a book called Palm Sunday, and in it he said that he thought the number one killer wasn't cardiovascular disease, but loneliness.
Yes.
So eating together is such a bonding experience. And there's another Cornell study by Professor Kevin Kinner.
Yes.
Tell us about that.
Yeah, essentially in 2015, Cornell University did a study that proved that firefighters who eat spaghetti in the firehouse together work better as a team. They save more lives.
Wow.
And so the simple thing of using pasta sauce as a tool to connect not only strangers, but people who work together every day is a scientifically backed thing.
Right, it was Professor Kevin Niffen that did the study at Cornell.
Yeah.
And he also found that in families, any relationship, cooking together, eating together, creates a bond and creates teamwork and superior productivity in companies.
Love that. I mean, PwC found that for every dollar you spent on employee well-being, emotional or spiritual well-being, yields $2.30 back in productivity. And eating together is one of those greatest investments. We've dedicated the last 3.5 years of our life to using pasta sauce in the dinner table as a form of human connection. And to take it a step further, what's printed on that jar of pasta sauce
What does it say?
is the same question we ask at every dinner.
What is that question?
If you could give credit or thanks to one person in your life that you don't give enough credit or thanks to.
It does ask that here. So that's your magical question, because most people, when there's a gathering together, would ask, what do you do?
Yeah, what do you do? What are you afraid of? What's your biggest fear? What's your biggest failure? Those are not questions that lead to connection.
Gratitude. It's at the core then.
Yeah, our core hypothesis as a team, after asking this question about gratitude to many, many, many great people over the last 3.5 years, we've used this question to spark over 350,000 relationships around our dinner table. And what we found is that when people give gratitude to others, using this question, leads them down the road to fulfillment. It helps them connect, which helps you be less lonely, helps develop empathy, which helps you be less lonely, and it's ultimately better for business. When you can form empathetic, gratitude-filled relationships with your VIP clients, partners, teams, revenue increases.
And empathy being the ability to walk in someone else's shoes and actually feeling what they are feeling.
Exactly.
And if a company wants to get a hold of you, how do they do so?
Yeah, if a company wants to engage with us, we love going in and help companies show greater gratitude to their VIP clients and partners. Just email info@747club.org and someone on the team will reach out, and we'd love to hear what you guys are going through.
And who are you most grateful for?
Oh gosh, who am I most grateful for that I don't?
That you don't thank enough.
Probably my dad.
Phil Schembra.
Phil
We
Schembra.
love Phil.
I mean, that's how we know each other.
That's how we know each other, yes.
And, you know, I've asked this question to tens of thousands of people in the last 3.5 years, and I get the chance to answer it a lot. But I find that even though I gave voice to my dad a couple times early on, I still need to practice giving gratitude to him on a consistent basis. Many people in my life on a consistent basis, because if you just do it once, it's not good enough. You have to practice a consistent strategy.
Right.
And I definitely haven't given enough credit, thanks to my dad.
Well, thank you, Dad, Phil Schembra. Thank you to my dad as well. And again, I'm so grateful that I have your pasta sauce.
I hope you enjoy it as an Italian.
I
my
know.
gosh.
Thank you so much.
Pressure.
And just learned that you're also a Virgo.
Yes.
So very grateful for this. And if you want to attend one of the dinners, now is it through a company, or if there's an individual out there that wants to attend one of the dinners,
so
can they?
Pretty much we just work with companies now.
With companies, great.
And so if you have a company and you value your client relationships, you value leadership and team bonding, definitely reach out, and we love to
and
talk
healthy
with you.
relationships, because it's been proven that people could work together and not even connect unless they're in the cafeteria. That people have worked together for years, and the first time they ever talk is just when they go to the lunchroom. So it's actually proven that food creates better relationships. Better relationships creates a better working environment, and it does reach the bottom line.
Yep. Every time.
Right?
Every time.
Well, thank you for being here.
Thank you for having me.
I enjoyed it, and we'll have you back another time.
Sounds good to me.
Thank you.
Thank you.
Thanks for joining. Welcome to Bold TV. Almost 30 million women suffer silently with menopause symptoms at work. My guest today is Dr. Soma Mandal, a midlife's women's health expert and board-certified internist. She received her medical degree from NYU with a research fellowship at Oxford. She's written a new book called Dear Menopause, I Do Not Fear You. It'll help women live their boldest life during this time. Welcome, Dr. Mandal.
Thanks for having me, Maria.
How are you?
I'm good, thank you.
Well, on my way over here, I read that menopause is slated to be a $3.3 billion industry in 2023. A lot of pharmaceutical companies are looking for treatments. What are the symptoms that most women experience?
That's not a surprise to me at all, because menopause is something that all women go through. So the symptoms can begin as early as your late 30s to your early 50s, and it can start with fatigue, irritability, dry hair, dry skin, night sweats, hot flashes, and obviously a change in your menstrual cycle.
And the definition of menopause is the complete stop of the menstrual cycle.
That's correct.
Right?
So,
and that can also be brought on by cancers.
So the women who go through hysterectomies, total hysterectomies, I should say,
Yes.
where their uterus and ovaries are removed, go through menopause for those reasons.
Actress Angelina Jolie talked about having her fallopian tubes removed and uterus because of the breast cancer, and it forced her into menopause.
That's right.
And she opted for natural therapies. Let's talk about some of the treatments, because that's what most women want.
Yes.
If anybody's watching, that's what they want to know, is what do you do when you sweat and your face is red and you're uncomfortable? Get to tell us, you're the expert.
Sure. So not every woman needs treatment. The symptoms of menopause can be very variable, and not everyone goes through, the different things that I just mentioned. There are some women, unfortunately, who have pronounced symptoms. And in those particular cases, I always advise, whether it's my friends or my patients to really seek the medical care, the medical advice of either their internist or their gynecologist, because they need to, if they are going to start medications, then they need to make an informed decision as to what's best for them.
Although a lot of women, not even some, a lot of women say they go to their physicians and the symptoms are dismissed. They're not taken seriously. I love what someone, I think it's Lisa Stryker at Northwestern Memorial Hospital in Chicago. She's doing something fantastic. They started a new clinic just focusing on this, and she wants to make sure that every family practitioner, every clinician is educated on menopause so women's symptoms aren't dismissed. I mean, what do you say about that?
It's a real shame, and I think that these are things that not every person is aware of. Unfortunately, not every physician is well rehearsed on this.
They don't teach it in medical school.
Of course they do.
20%.
They do teach it, but not in the terms of what it really means. So yes, we sit in the classroom and we learn about all the different hormones and the changes that happen. But I don't think there's a significance as to what it really means and what the woman feels as she's going through it. And being as someone in midlife at this point, I truly appreciate it because it's something that we all go through. And whether it's a man physician or a woman physician, I think there needs to be more education about it. That being said, your friends are your biggest resources. So if you are having symptoms and you don't know where to reach out to another friend who may be going through the same thing. Talk to her about who she may be seeing.
That's great advice. And what about, you mentioned portable fans and layered clothing. Tell us about that, because it actually does help. I've heard people say that they love the little portable fans. Like, wow, they're...
Well, we're taking over the workforce, or trying to, and so with that, there are more women at work, and when I have a woman who comes in, they're like, what should I do? The first thing I say, wear layers. That way you can peel off, your sweater, your cardigan. If it's a shirt that you can take off and wear something lighter, it gives you a little bit more breathing room. Wear natural fibers like cotton that breathe better. These are all things that we all can do. The polyester fabrics tend to hold the moisture in and make you feel hotter than you really should.
What about nutrition? Are certain foods triggers or certain beverages?
Sure. So things like caffeine, alcohol, they tend to make symptoms worse. So a cup of coffee doesn't do much. But if you're having a lot of coffee, more than 2 or 3 cups a day, and you're having these symptoms, then it's time to dial back down.
What else? You mentioned some other natural therapies.
So there are a bunch of natural therapies. Unfortunately, not all of them have been well studied. But the one that is most well known in this is black cohosh. Black cohosh is a plant, is a derivative of the buttercup family. And Native Americans use these plants as part of treatments for menopause.
Where does someone get that?
You could find it at most stores.
Is it a supplement?
It's a supplement. You can find it at most pharmacies. You can get it at natural food stores. And the way it works is it is not something that increases your estrogen level, but it somehow enhances the effect of the natural estrogen that's already in our body. That may be due to some effect on dopamine and serotonin. The mechanism isn't exactly well known.
And what about omega-3?
Omega-3 can be good in certain cases where women who are going through menopause may have issues with their cholesterol and triglycerides. But I always caution patients to use omega-3 with some advice. For example, there are omega-3s that are not necessarily the best brands, and they can actually increase your cholesterol, specifically your LDL cholesterol. So I always guide a patient as to when or not to use omega-3s.
And what about fatty fish? I read that fatty fish, certain types are help symptoms.
So when you get vitamins and minerals, omega-3, whatever it is, through natural food sources, it's not going to have the same effect as I just discussed. So if you get it from flaxseed, from sardines, from the salmon, as you mentioned, then these are good ways of getting natural omega-3 into your diet.
And what role does exercise play?
Exercise plays a huge role because we know that it can reduce a lot of different things, like the depression, like the anxiety. It can actually even reduce the symptoms of the hot flashes and night sweats and improve your sleep quality as well.
I was also surprised to read how long women suffer, that some of the symptoms can last as long as 7 years.
That's correct, yes. And in my experience, and then this is anecdotally from my own practice, I find that it's variable in terms of when it presents and how long it actually lasts for.
And what about pain during sex? Women don't like to talk about that.
Yes.
What's the best remedy for that?
So, different things. And having discussed this with different GYNs who actually specialize in this area, it can be as simple as organic coconut oil to certain lubricants.
Applied topically?
Applied topically to the vaginal area, to, there are various lubricants you can use. And then in more extreme cases, you can use topical estrogen to help with those types of symptoms.
And if women want to get a hold of you, where can they reach you?
I practice at Summit Medical Group in Berkeley Heights.
Berkeley Heights, New Jersey.
In Berkeley Heights, New Jersey, yes.
Yes.
And I've been there for 5 years, and my expertise is in women's health.
That's wonderful. So most of the women do come in to talk to you about things like this.
Yes.
Do you find any advances being made or anything in the future that we should know about that's coming out?
Well, there was one big study that's still very important to this day, and that was the Women's Health Initiative. It was a 15-year study that studied more than 160,000 women ages 50s to 70s. And it actually changed the way we practice medicine, specifically hormone replacement therapy. So before this study came out, and this was in the early 2000s, we used estrogen for a lot of women.
Right.
And this study changed everything because it showed that there was a slightly higher risk of breast cancer, higher risk of estrogen productive cancers like endometriosis and endometrial cancer. And it also showed a higher risk of heart disease. Unfortunately, hormone replacement in this study actually improved osteoporosis, and it showed an improvement in reducing the risk of colon cancer, but we do not treat with hormone replacement for those two things.
Right. I was amazed to find how in the 90s, everyone was treated with that, and then they found increased risks for other things.
That's right.
It's better to take more natural approaches until there's something viable.
That's right.
Right. And brain fog, is it real?
It is very real, and I think a lot of us who have children, we go from brain fog from pregnancy to brain fog during menopause or perimenopause and menopause, and it's really not known how this mechanism occurs, but estrogen somehow plays a big role in it because estrogen is involved with the brain, and as our estrogen levels decrease, that's when the brain fog
So what can women do? Tie a ribbon around their finger to remember things, or it's a real concern.
It's a real thing. And so writing things down.
Yes.
Doing things to exercise the brain, which is exercise.
Absolutely.
Cardiovascular exercise, and also doing things to keep your brain active as well.
Absolutely.
These are all important things.
And what's your website?
My website is drsomamandel.com.
Great. Thank you so much for being with us.
Thank you.
Great information. So it's Dr. Soma Mandel. That's MANDAL, right?
That's right.
.com. It's a terrific topic. If you have any questions, you can list them below, and we'll make sure that Dr. Soma gets them. Thank you for joining us. Hi everyone, welcome to Bold TV. I'm really excited that you're with us today because I have a terrific guest with us that is the solution to a problem that you've been hearing a lot about on media. And that's that the World Health Organization has deemed an ingredient, a chemical ingredient in Roundup to be carcinogenic and cancer causing. And you might think that it just affects farmers, but it's on golf courses, it's in parks, it's affecting children, it affects everything. So James Messina is the CEO of Messina's and makes an organic, natural product that doesn't cause cancer. We're glad that you have a solution to this problem.
Well, thanks for having me.
You're very welcome. Now, the World Health Organization has called it a carcinogenic, but yet the Environmental Protection Agency says it's fine.
So there's a lot of noise out there about Roundup and about the active ingredient glyphosate. And what I'm sure you've read and so many other folks have seen is that when there's this much noise, they don't really know which way to go. They don't know who to trust. And so people are really looking for viable alternatives that they can kind of put their faith in that don't have the air of all this confusion circling around it.
My cousin's husband works in citrus fruits. And I asked him, I said, you know, Roundup has been around for 40 years, but now we have lawsuits. And I said, why aren't you using these organic products? And what he said to me was, they don't work.
Well, you know, that's been the biggest problem with the natural products and products that are for organic gardening in the growing world, is that traditionally so many of them have come to the marketplace with very little efficacy or very a lessened ability to actually perform. And consumers are disappointed by performance. You know, and when you couple that with packaging that looks really kind of soft and gentle, it really puts a feeling in the consumer's mind or in the user's mind that this is something that's going to be a lot weaker than what they're used to with chemicals. But that doesn't have to be the case.
Now your product has a very powerful name.
Correct.
Pulverized.
Pulverized,
You
yeah.
can't get any stronger than that.
That's right.
So tell me, it does work.
It does work, yeah.
And that's the message that we want to get out to farmers, consumers, everybody, that there's absolutely no excuse for anyone to be carrying Roundup.
Well, you know, it took us about 3 years to come up with a name for our weed killer because Roundup is a great name. You know, people know it. And we wanted to have something really strong that really put some confidence in the consumer's mind. And so when we came up with our name Pulverize, it literally means to turn to dust. We want folks to understand that this product is going to wipe out their weed problem and do it in a way that's going to be something that they can be really confident in its chemistry, that it's not going to have the health effects of some of the harsher chemicals in the country.
Right. Now, what about pulling weeds?
Sure. If you want to talk about a scale of safety from the very safest thing you can do, using those tools at the end of your arms is really going to be the safest thing. You know, go out there, get your hands dirty, get in the soil. It feels really good, but it's not going to be the thing that folks can do all the time. You know, there's going to come a time and place where they're going to want a shortcut. They're going to want a way to just kind of eradicate a problem and do something differently than just getting out there with their hands in the soil.
Right. And one of the things that I wasn't aware of that I just learned was Ben Callos is a city council member. He's sponsoring a bill. It's Bill 1524, and he wants it outlawed using
Roundup in the public
Roundup
parks.
in public parks.
Yeah, and we've reached out and we've let him know about the options of using a product like Pulverize, which again is for organic gardening, and we want to let him know, just like we're working with municipalities all across the country in California and Florida and New Mexico.
Right, Miami it has just outlawed it.
Yeah.
Shout out to Costco for removing it from their shelves, store shelves. But I think today health is so important that if you want to align yourself, your brand with health, you can't be selling a product like Roundup.
It seems
You just can't.
It's counterintuitive, absolutely.
Right? I mean, most brands today do want to be healthy. And the new hamburger, I just on my way over here read that the new vegan burger, they found traces of glyphosate in there.
They did.
What is it? Impossible?
Impossible Burger. So the reason why foods like Impossible, even Cheerios and Ben & Jerry's ice cream last year came out as testing positive for the ingredient glyphosate is due in part because of the Roundup resistant crops. You know, the product itself works systemically, so it gets absorbed by the plant. and that's how it starts to destroy the plant from the inside, as far as my limited knowledge on it is.
Right.
And what happens with Roundup resistant crops is once they absorb that weed killer, they don't die. And so when those crops are then harvested, that's how it's getting into our food source. And that is the reason why there is more and more concern about what these ingredients are doing to the human body, the bacteria in your guts, as well as the cell structure in your own
Right.
person.
So what's the kind of response that you get when you do reach out to
Municipalities?
Yeah.
They have been ecstatic to hear from us, actually. It's been really very welcoming. Whether it's Key West or Marin County, Sonoma, even up in Chicago, every time we reach out to a municipality and say, hey, we do have a viable option,
Right.
they're so pleased because our products are registered for sale in all 50 states. We're not a mom and pop who's just, talking about something that we created in our bathtub that maybe is effective and maybe isn't. We have efficacy data that we can share with them. And they're very, very welcoming with a product like ours that is already on about 10,000 store shelves. So they realize that it is a real
Right.
brand that they can put some trust into.
The evidence is out there, it keeps mounting, and a lot of times it's because they say there's a problem but there's no solution to it.
Right.
And that's why I was so thrilled to have you on the show. You've been working in lawn care business for 30 years.
So my family owned and operated a garden center back in the 70s, and whether I was running around helping my dad mix soil or getting in trouble for pulling the wrong plants out of pots, I had a really good foundation in lawn and garden. And when I graduated college, I worked with my family to develop the company that is now Messina's to provide natural or safer alternatives to things like animal repellents and fertilizers and now weed killers. And we've been actively in the consumer space since about 2004, selling our products on store shelves in all 50 states and now 4 or 5 countries around the world.
That's terrific. And many countries have banned glyphosate.
Yes.
I mean, the goal would be to just ban it completely
Well-
and eradicate, pulverize. I have zero tolerance. When there's a solution for something and you're still using the problem,
Yeah.
then the problem is you and you're part of it.
Well, and that's the fun part for us right now, is we are educating folks that there are viable alternatives. Because, to your point earlier, to ask somebody to stop doing an activity is all well and good, but if you don't have a solution for them, it's going to be a lot harder for them to
Right.
change. It's all about education. It's all about letting folks know about the opportunities, because let's face it, marketing budgets of big companies dwarf us up-and-comers. And so it's
Right.
that word of mouth that really gets us to the table.
Now, have there been organic products in the past that were weak?
Sure.
What caused the kind of reputation out there that, the organic products don't work?
So because EPA has certain rules and regulations, one of them is called a Category 25B FIFRA exemption.
What
which
is that?
A very fancy way of saying that the EPA has deemed if you come up with a product containing these ingredients, we think it's so safe, you don't need any regulatory from us.
Okay.
And so small companies, as long as they use those ingredients, can make any claim they want within reason, and actually say that products are effective without the years of efficacy data or proof that are behind some of the big chemical companies. And so consumers and store buyers become less interested in trying those natural alternatives because they just have failed to work for years and years and years.
So your product can be used from anything from, let's say I have a small home and have a driveway.
Whether you're a homeowner who has a small patch of grass that just wants to keep it looking green, or you're a commercial grower who has thousands of acres and needs to do some weed prevention, we do have different pulverized products that are going to work very effectively for those different situations.
And what about vegetables? When you're growing vegetables, do you spray it? Does it stay off of are you spraying it on the vegetables?
No, you're spraying it
Or-
on the weeds you want to kill. So remember,
Just on
the
the
plants
weeds,
you want to
okay.
kill. Yeah, so you can use it
Okay.
in your vegetable gardens as well. And as long as you're just targeting the plants that you are that you want to get rid of and don't overspray onto your vegetables, you're going to be fine. The mode of operation is completely different. The way it works is completely different than, say, a systemic product like glyphosate, like we talked about before, how it's absorbed. With pulverized, it's going to be a product that actually breaks down the cuticles of the cell walls of the leaves themselves, and it's going to destroy from the top down. And that's why you don't have to worry about it, being a problem in vegetable gardens or in flower beds.
And is it gone forever?
The weed?
Yeah.
It depends upon what age the weed is when you're actually killing it. If it's a young weed, it's much easier to kill and get rid of. If it's an older weed, it might have a more robust root system. You may have to make a second or third application. But, you know, at least for me, I'd rather make 3 applications of a product for organic
That's
gardening
safe.
than, you know, a product that maybe has a chemical component that, you know, in time will prove to be something that's pretty unhealthy for us.
Right. You told me that, you know, talk about what your mission is, because I think that says a lot about your family name, your product, your brand, and what you put out
So
there.
we put our family name on every single bottle we sell. We want folks to understand that there's a family behind these products, a family that knows what you're trying to do, wants you to trust in us, that we actually will not put our name on something that we really don't believe in. And we want folks to know that there's folks that they can turn to with their gardening questions. And while we may not have the perfect solution for you, we have no problem recommending somebody who does. We are more interested in making sure you can be successful at getting your hands in the dirt than we are you always using one of our products. Because at the end of the day, this is a hobby that we've been doing as humans for some 40,000 years. It's not going away.
Right.
But the more enjoyable we can make it, the more we think it's going to keep going on and on and on.
Right. Well, thank you,
Thank you.
for the product. And I have to add, today is your birthday.
It is my
Happy
birthday. Thank you very
birthday.
much.
And everyone watching, you can help me wish James a happy birthday by sharing and clicking like on this and sharing this on social media so the word gets out. And you can go to his website is www.messinas.com. A shout out to Carrie Sheffield for having us here today. Thank you, and to the Bold staff.
Welcome to Bold TV. I'm Mike Paul, filling in for Maria Dorfner this week. Today's guest has developed the first sustainable solution for the lifetime care of autistic children based on her experience with her own son, Nicky. Welcome, Adriana.
It is a pleasure to be here, Mike.
So tell us about your son, Nicky.
Nicky was born with something called tuberous sclerosis, and he's going to be 21 years old in December. He's nonverbal. He doesn't walk, doesn't talk. He's not potty training. He doesn't feed himself.
Oh.
And he'd been going to the school, to the special school, but once they reach 21, they fall off the cliff, meaning the services get cut 75%. And on the top of it, he's 6'2", 190 to 100 pounds. And I am, we're getting older, as everybody is, and it's harder to taking care of him and lifting him up when he's dropping himself. So we started to look at different solutions and find, if there's anything for him there.
So what led you to start Nicky's Gardens of Hope? I have a 10-year-old stepson who has both autism and ADHD, so I feel what you're going through, and I understand some of the challenges especially that you're going through. But tell us about Nicky's Garden of Hope. Is it a business? Is it a charity? In a few sentences, can you describe what it is?
Well, it's a combination of both, believe it or not. We do not want to be dependent on the government because of the government cuts. The tax credits to donations is not where they used to be. And having nonprofit organization that will be providing just the care and services for adults with autism and other disabilities, the for-profit is going to hold the real estate and incubator businesses that will employ people with disabilities, with autism, Down syndrome, and other disabilities as well.
So let me see if I can summarize exactly what it is that Nicky's Gardens of Hope has as some of its pieces. So number one, you also want to raise money from a charitable perspective, but the business side of it is you're seeking to have a holistic solution, if I understand it correctly, for those, especially young adults that are moving from like 18 to let's say 21 and have to have their own living environment with their special needs. So from a holistic perspective, let's say you have one home you're starting with, and you might have several special needs adults that are living in this dwelling place. Will there be someone that lives there as a supervisor? Describe it for me as though it's one home.
Well, there will be nurses 24/7. It depends on the way they are disabled. My son needs my son needs care 24/7.
Yes.
And there are many like him, but there are also highly functioning people with autism. So the whole project, it's literally building the community of combination of the disabled as my son and then highly functioning, that they can work, be trained and work in our community and the properties and incubator businesses. So we're not going to only provide the residential and that's it. We will try to give them as independent living as possible for the ones that they can work. Because I strongly believe that there's no disability, but there's a different abilities. Even my son has a different abilities. It's up to us to figure out what they're good at, what they like, and how we can help them to grow. Even in housing for highly functioning adults with disabilities, there's going to be somebody who's going to be able to help them with opening bank accounts. But they do want to be part of the society, and this is my whole goal.
Right.
Let them work. Not only residential and that's it,
Understood.
but also
a holistic approach to it. So
yes.
Where are you looking for the first Nikki's Gardens of Hope, as you say, holistic community to be?
So there is a property at Esopus, upstate New York, that we're looking at. It's 520 acres. It's right on the Hudson. Has a beautiful views.
What town?
It's already school on the property as well.
What town is that?
It's Esopus.
Esopus. What is that near?
Yes.
What other larger town?
New Paltz?
Near New Paltz.
New Paltz area?
Yes, that's nice.
Yes.
500 and something
property.
acres. I'm sorry.
Yes.
500 something acres. That's quite a large. That is a community onto its own. So, how much money are you seeking to raise?
So right now, we did add Bob Zukolski to our board, and we're looking to raise from, believe it or not, donations, $500,000 for feasibility study, because the approach we are taking, as we know, does not exist right now, combination between for-profit and non-profit. We need a feasibility studies to go and present this to the potential impact and socially responsible investors to prove that this might work.
And after the impact study, how much money are you looking to raise? It has to be in the millions, for example.
$65 million.
Okay. $65 million for that initial 500-acre property. You believe that that would give you the holistic services and the first phase of what you're looking to do?
Yes.
Is there any other community or any other living facility with holistic services that is out there as an example, not exactly what you're seeking to do, but something that other people could look at to say that this is potentially doable if they're looking to make an investment? There
is Discovery Center for Discovery, upstate New York. There is also Anderson Center for Autism. There is New Hope Community, all upstate New York. And there are a few outside of New York as well.
Do you think that is something that could be done in an urban environment? I know upstate New York well. I went to school there. My family has had property there. So I know the difference between upstate New York, for example, and New York City. Very different. Different as far as space and different as far as cost. But do you think this is also something that needs to be done in urban environments within cities around the country as well, not just in rural communities, let's say like upstate New York?
Oh, definitely. It could be scalable, and this is what we're trying to do. The only thing that what our project will have, it's the incubator businesses that, we're looking at having lodge for parents and kids with autism and other disabilities to come, and we will take care of the children, and the parents can have the weekend or whole week, however long they're going to stay, for themselves. Because we believe that mental health of parents or caretaker is as important as health of the child or adult with disabilities. And right now, as we know, it does not exist any hotel or any hospitality like that. But to answer your question, yes, it could be scalable in the cities as well under different, planning
Yes.
and different businesses. But yes.
Adriana, I want to thank you so much for sharing your story. As I mentioned, it's close to my heart because I have a son who has autism. Thank you so much for sharing. And anyone who wants to get more information about Nikki's Gardens of Hope can look them up on the internet at nikkisgardensofhope.com. And thank you for joining us. Please like and follow Bold TV. That was a very important subject. We thank you for joining us today. Goodbye.